Our third speaker for today's session is Dr. Susan Pacheco. She's an associate professor at the University of Texas Health Science Center. She specializes in pediatric asthma, allergy, and immunology. She's also the founder of the Alliance of Health Professionals Against Climate Change, and today she'll be talking about the impacts of climate change on lung health.
Thank you so much. I appreciate Dr. Cornfield, thank you for the invitations, and all of you here for giving me 20 minutes of your time when you can be doing some other things. And of course, this is a very dear topic to many of us. And you can say maybe somewhat depressing. However, having a group of like-minded individuals here trying to think about this and try to find solutions to these problems is reassuring. I don't have anything. So what I'll do today, very briefly review talk briefly about the climate crisis. And I'm not going to do much because I've had the foundation with my colleagues that spoke before, and then tell you about pregnancy and what happens in utero. And we talk about the vulnerable groups, and I think that before birth stage is the most vulnerable, right? When I was a baby doctor, I used to think that the uterus was sacred, but I have discovered that it's not. Now, the most important thing, and I'm not going to make this data heavy, is to reflect on what we have, what's coming, and what we can do, because there's many things that we can do. So, industrial revolution, CO2 goes up, correlation with heat, so the temperatures go up. And now we have a warming planet. And if you see the changes here, the temperature anomalies have continued to increase throughout the years. And that's what we have today. And we come to, I'm sorry, my hands. We come to a different world where extreme weather events are the norm. So what happens? Shifting gears. We think that different than people here in this audience that entered, including myself, the climate crisis already developed and matured, it's different for the prenatal stage. And the problem is that children get affected when they are in utero, but it's not only that, because they're going to live in an environment that is already degraded and will continue to degrade. So if we think about cumulative damage, this will do it. Now, so what happens? We have the climate change related exposures. And you can see them here. All of them are known to affect pregnancy through an indirect way, which is the adverse pregnancy outcomes. And what happens is that these adverse pregnancy outcomes can lead to chronic lung disease. In the US alone, we have 10 to 15,000 births per year of children that develop BPD. Now, there are 3 of them that we know that affect directly lung development. Mechanisms are not very clear, but I will be talking about this mainly in the context of asthma and wheeze. And then we have the exposome and all of the social, political, and cultural determinants of health that affect women in particular. So I'll talk about very briefly maternal stress, temperature changes, and air pollution. I want to give a disclaimer that I will not talk about windows of vulnerability because it's very, it's still a moving target, even though there's data saying that we're moving more towards the 3rd trimester for some of the exposures. And then I'll end with air pollution. Now, maternal stress is a big problem because the exposure that is there affects every aspect of the woman that is not only pregnant, but is in charge of many times commanding a family. And if you think about this, and you think about the fact that we don't have good resources for mental health care, it's going to be a big problem. Just as an example, these are disasters in the last 2 decades of the 20th century and the first 2 decades of the 21st century, and the numbers almost doubled. And just look at the number of people that are affected and try to extrapolate to the stress that women have been exposed to. And this is only for floods, but it happens for all of the other disasters. So what happens? We know that psychological stress affects childhood asthma and wheeze. And actually, the adjusted ratio for this odds ratio is 1.59 in terms of the increase. And these were wheeze in children up to 2 years of age and asthma in children up to 14 years of age. Now, you know what I did? I'm reading from here and I'm there, okay? Okay, so this is the one. Now, do we know how that happens? The answer is no. And that is what is a bit concerning. There's some studies where high maternal stress have been associated with increased risk of persistent wheeze until age 5. And genome-wide perturbations is very interesting because there are changes in methylation in the whole genome. And this is seen in areas that have to do with long maturation and type 2 cytokines. Now, for those that are not very familiar, for allergic asthma or atopic asthma, type 2 cytokines are the ones that are favored. So we come to heat, and thank you for that introduction. What happens with heat? This study is very interesting because it looks about the association between exposure to elevated temperatures and the risk of preterm birth, low birth weight, and stillborns. 70 studies, 27 countries. The impact was more pronounced in developing countries. And this is the number of studies, 40 out of 47 had a positive correlation with exposure and temperature increase. Stillbirths is very important because, of course, it's towards the end of the pregnancy, but not only that, it's just something that comes as a surprise many times when you get exposed during the last week of your pregnancy and something happens. And here, 8 out of 8 studies showed that. Low birth weight was not that significant. Odds of preterm birth during heat waves, you can see there, odds ratio is 1.16. And the odds of preterm birth weight per degree of increase in temperature is also increased 1.05. So we have that these changes are affecting, there you go. These changes are affecting all aspects of pregnancies. And it's, when they talk in these studies, when they talk about heat waves, they only talk about 2 days of exposure. Now, this study I'm only going to mention because it's very interesting. It's a pulmonary function test in babies that are 2 months of age. They measure functional residual capacity and respiratory rate and tidal volume. And high temperatures and low temperatures extremes decrease the functional residual capacity and increase the respiratory rate, mainly in girls. Mainly in girls, and it was a strong association. So do we know, and I'm talking mainly about human data, do we know what causes this? And there are many, many hypotheses about what can do it that makes sense. However, the long story short is that we don't understand these mechanisms. So we cannot tell the patients that this is what's going to happen, this is what's going to happen. But we can tell people to avoid exposures. Air pollution, I call air pollution the nightmare that fuels my efforts because we are all exposed, and the damage that people are not aware of the damage that air pollution makes. I have, I call it a multisystemic disease because basically every organ system is affected. I am not going to go over this because it's been said many times. However, and here also, when we talk about air pollutions, it's a mixture of everything. It's a mixture of natural sources, anthropogenic sources. Now, wildfire exposure has already been mentioned here, and there's a lot of toxic and hazardous pollutants there. However, there's very limited research. I was surprised because there's very limited research on the effects of wildfires on pregnancy. 10 articles so far. And it seems that the exposure to air pollution, even during pregnancy, is more toxic. Exposure to pollution of wildfires during pregnancy is more toxic, but I was not able to find any studies that will make a comparison. You've seen this, and it's in the news, right? And we don't blame people for anything, that's rude. But what happened in New York recently has been going on for some time. If you see the top panel there, something very similar happened in 2021 with forest fires in Canada. And on the other panel, bottom panel, 2017, the fires in Canada and in the Northwest extended to Europe. So the French people were not very happy. And what is very sobering also is the Siberia fires. You know, we have the Siberia fires that have been happening for some time, and the smoke in the Siberian fires is extending to Alaska and Canada, and it will continue to happen. So we're not on this alone, and we cannot say that we are not affected, therefore we're not going to care, because in reality, everybody's affected one way or another. In 2021, WHO reviewed the standards for air quality, and what was done in this study was to analyze 2019 according to the new standards, and as it turns out, 0.001 of the population live in places that met the requirements of WHO. So the problem with air pollution is pervasive. Now, if you remember one graph, one slide, I want you to remember this, because air pollution enters respiratory tract, goes to the lungs or goes to the brain. Particles can stay there, cause inflammatory response, or the particles can migrate and distribute throughout the body. This slide is mainly for cardiovascular effects. However, you can put almost any organ system in that little picture there, and it will apply. Because again, air pollution causes multi-systemic disease. So systemic inflammation spreads, and what happens? We have that inflammation affects the pregnant woman. It reaches the mother, that systemic inflammation, that the mother's placenta get affected. And there's evidence that oxidative damage happens and changes in nanoparticles, changes induced by nanoparticles. You know, but the other thing that we have is epigenetic changes, including epigenetic changes in the mitochondrial DNA. And that happens, that leads us to adverse pregnancy outcomes and changes in lung function. Now, this article was published in 2019. And what they saw, and I've been following the work of this group from some time, because the first thing that they saw was, okay, black carbon particles reach the placenta. Okay, then the subsequent study here is you can find the black carbon particles on the fetal side of the placenta, and it's in the dose-dependent manner. The group published a study in 2022 where they can find particles in the brain, the lungs, and the liver of fetuses from mothers that have been exposed to air pollution, again, in a dose-dependent manner. What are they going to do there? We don't know, but it's a very sobering problem. So just some examples about air pollution. We published this article in 2020, and actually what we saw was that there was increased risk for all parameters, adverse pregnancy outcomes, preterm birth, low birth weight, and stillbirth with exposure to PM 2.5 and ground level ozone. What's happening? There's some changes in the immune system. This study looked at what was in the mucosa at 4 weeks of age, and there were profiles that were suggestive of type 2 immunity. The blood profiles in babies at 6 months was also changed, and The same group followed 6 years later had increased odds of allergy, 2.57, and asthma, 1.8. So this is evidence that the immune alterations that we find early on can cause problems later on. Now, this is the first paper that shows that PM1, which is not regulated by the Environmental Protection Agency, but PM1, particles of 1 micron, can also cause adverse pregnancy outcomes, many times more than what you find in PM2.5 and PM10. The only reason why I have this article here, this article here is to show, and I'm glad that it's been mentioned before, there's going to be synergy. And this is one of the first articles that shows that the combination of air pollution with temperature affects the pregnancy outcomes and affects childhood asthma. There's a similar article where they do air pollution in combination with temperature, and you have increased incidence of pneumonia. So when you add maternal stress and you add air pollution and you add temperature and you add nutritional changes and you add displacement, it just creates a storm that is difficult to imagine what's going to do for the future generations. These articles here, this slide here, what I have is infections, and there's increased incidence of infections of the airways in days of pollution. This happens with air pollution, it happens with temperature and psychological distress. And many studies talk about pneumonia, but there's also studies about bronchitis. There's studies about increased susceptibility to viral infections and ear infections. So again, this compounds the problem that we are facing with these populations. So, I've presented very briefly, of course, this is a very complex subject, but I've presented very briefly what climate change and air pollution and the changes that we're seeing are doing to the pregnancy. And it's not difficult to imagine that the problem is going to be getting compounded. And what we have to do, what we have to ask ourselves is, where do we stand, right? And again, it gives me hope that we're here and there's a group of people that are interested in this. But then, what are we going to do with this knowledge? I joke with my students and tell them, I'm tired of these call to actions that I keep reading about climate change. We need to do something. What is our call to action? And we can take very simple, make very simple interventions. If you want to stay at the personal level, just tell a person, a friend, tell a friend, hey, listen, air pollution, whatever. But we have the power and we have the responsibility and we have the knowledge to do more. We can tell our patients, we can engage our colleagues. And if we are interested, we can engage in policy to make a difference in the future generations, because people like me, we owe it to the younger generations because we've done a lousy job protecting the planet. And younger people, you guys need to bring it up because this is where you're going to live for the next years. Thank you so much.